Coming up today, telemedicine and its vital role for patients everywhere. We explore the benefits you might not realize, plus the concern that convenient access might disappear. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. One of the best things to come out of the COVID-19 pandemic was the expansion of telemedicine. Video visits were a way to reduce the risk of exposure, but more importantly, they're practical, especially for patients who may live hours away from their specialized doctors. Bottom line, telemedicine has helped connect patients with care they may otherwise might have not been able to get. So today we are focused on palliative care, a specialty that has really benefited from the expansion of telemedicine. And today we are joined by Dr. Karen Porter-Williamson, Division Director of Palliative Care here at the University of Kansas Health System. Good morning to you.
Good morning. Thank you for having us.
Yes, great to have you today. Working with Dr. Porter-Williamson, our Lauren Seinfeld. How are you?
Good, thank you.
Registered nurse, and also with us today, Kate Shoemaker, social worker. Ladies, thank you for being here.
Thank you for having us.
We are also joined today by Sharon Jones, joining us in Liberal, Kansas. That is in southwestern Kansas. That is about a 6-hour drive from the Kansas City area. Her late husband, Eugene, was a patient of Dr. Porter-Williamson's before passing away about a year ago. And Sharon, first of all, our condolences to you and your family, and we just thank you for joining us this morning to talk a little bit more about him. How are you?
Good, thank you. Thank you for having me. It's an honor to be here. Thank you.
Well, Sharon, you shared a few photos of your husband, and aside from everything medical, which we're going to get to here in just a moment, what was he like as a person and as a husband? Tell us about him.
He was one of the most generous people I have ever known. If someone needed something, he was more than ready to meet that need. And he was an entrepreneur. He owned his own business that I helped him run for over 40 years. He was always looking for ways to do things better, and he loved to explore new ideas and places and recipes. He loved to cook. And as a husband, he was always concerned about making sure that my interests were met and that he had my best interests at heart. He continually worried about what stress it was on me to take care of him, and he was just a very loving man. We had 40 years together and some very great adventures.
Well, everyone here in the studio is nodding their head. I think that they share the same feelings about your husband as well. And so we are very, very pleased to be talking more about him and sharing memories of him today. Can you tell us a little bit more about Eugene's medical history and how he ended up needing palliative care?
He was diagnosed with COPD in, I think it was 2018. He had a KU fraternity brother who recommended Dr. Laura Thomas at KU Med. And so we went there for an initial visit and met, the doctor there and the facility and everything. But then COVID hit, and so we began doing telehealth with her. We had reached a point where she recommended Dr. Porter-Williamson to us to continue on with Gene's care when she could no longer give him further help.
Eugene was seeing a doctor in Liberal up until that doctor passed away. What other healthcare options do you have in rural Kansas?
Not very many. We have one actual general practitioner doctor here in Liberal who does not accept Medicare patients. And then there are, I believe, 2 or 3 doctors who are ER doctors at the hospital here. But otherwise, it is just PAs. And to get the kind of medicines and things that Gene needed was not very doable here. We have no pulmonologists. We have no palliative care. So having this telehealth has been a real blessing.
Sharon, kind of talk us through what all was involved in making that trip to Kansas City, a 6-hour drive just one way. That's a lot.
Right, right. It was hard in the fact that we don't have any family that lives here in Liberal. And so, excuse me, when we made a trip, I had to load all of the oxygen tanks, all the suitcases, the wheelchair, prepare food to take with us because it was very hard to go in to eat, of course. But I think the biggest hardship was Gene's anxiety of running out of air. He was afraid we were going to have a wreck, or that his oxygen tanks would run out, or something like that. So it was very much a mental and physical hardship on both of us.
I can't imagine. I mean, a 6-hour road trip, if you're doing something you enjoy, isn't fun. But you mentioned the anxiety. I can't imagine what you were doing. And you're talking about 12 hours round trip for just a single doctor's visit. So
Right.
Let's think about that first time using telemedicine. What did that feel like, doing that from home?
Well, it was kind of strange to begin with, but after a few times, it really became more relaxed, and we were able to give information back and forth and feel like we were really getting heard and receiving good medical care. I honestly felt we got more time and more quality time and personalization with virtual meetings than we did with a 15-minute, actual visit with the doctor in his or her office. But that's my opinion.
Yeah. Dr. Porter Williamson, you'll take strange, won't you?
Sure.
You can work with that. We can work with that.
We have to be adaptable, and
Right.
the pandemic really did put us on our toes about saying, how do we just shift and get things done so that we can take care of our patients?
And it is an adjustment. We're used to just jumping in a car and coming to see doctors face to face.
Right.
So we're going to talk telemedicine, but what was it like working with Gene and Sharon?
Oh, Gene and Sharon, we're not supposed to have a favorite patient list, but Gene and Sharon were absolutely wonderful to work with. Really, you could see Gene's spirit shining through, and he was smart. And he also was an advocate, for himself, his own medical needs, and for Sharon, because he always was trying to make sure he was taking the best care of her possible. And as his medical needs became greater, he was dependent on so much oxygen, and he was isolated in his home. So it was a joy to be able to take care of him. I learned from talking with Sharon that our visits were not just a medical visit. That was like an outing for them. It was a social visit, and he would get his best shirt on. I didn't know this at the time. So it was just a joy to take care of them.
Kate,
Yeah.
what was it like?
Oh, it was wonderful to meet both Sharon and Gene. I think what I recall a lot about Gene is just how much of an advocate he is for this type of care. Every time we'd log on, he'd ask, what's going on with telehealth? We still have it? I mean, that's a huge mark that he left on me, is this type of care was so necessary for him, and with them being so far away, how incredibly important it was, and it became his advocacy too, and a big part of his legacy for us here at KU. We talk about the Joneses often, and the impact that they've left on our team.
I love that. Just hearing the adaptability is what I'm hearing you say about Gene. Lauren, what do you remember?
Just that they were just a breath of fresh air every time we got to see them. It was always like, oh, we get to see Eugene and Sharon today. Gene always brought his best jokes. And just the satisfaction of being able to help these people that we wouldn't have otherwise gotten to see.
Sure. What kind of palliative care did he need, and how did telehealth help in this particular case?
Right, yeah. I think Gene's care was really emblematic of all the different kinds of services that palliative care can provide. he had pretty intense physical symptoms. He had pretty marked shortness of breath, and he had very high oxygen needs. If you're familiar with oxygen, you know we're wiring together canisters, and he was on a significant amount of oxygen at home. So we were able to help him with that feeling of shortness of breath, the feeling of anxiety when you can't catch your air, and then the other things. Really, you know, we were able to help build rapport with Gene and Sharon to help keep him in charge as his physical health was declining, to say, what do I want to see happen with my medical care? You know, if my body comes to the time where things are shutting down, do I want to go into the hospital? Do I want to have hospice services be starting to come to me? I want the emergency providers to know what I want. So we were able to have a really solid plan in place that honored his wishes. He did not want to get put on life support machines, you know. So we were able to have orders in place in his home that outlined his wishes. And I came to learn, you know, from Sharon that out of hospital order that outlined his wishes. It's called Transportable Physician's Orders for Patient Preferences. They had that in their home, and they were able to work with the EMS people at the time it was necessary to make sure his wishes were honored at that time.
Dignity and control. That's fantastic. Lauren, you're often the main point of contact for patients. How do you assist patients and caregivers who might not be comfortable with technology? I would imagine that's a thing.
Oh, for sure. You know, it can be a lot of different things. You know, seeing if they have a family member who can assist them, just reassuring them that we're going to be there at the time of the visit, you know, helping them get on, troubleshooting in real time. You know, before we had our own medical assistants, it was usually us nurses doing it. And then when Epic switched formats for doing the telehealth, we were able to send out these messages through my chart with like pictographs explaining step by step how folks could get on. And then, you know, in real time, sometimes technology, you know, it's wonderful until it isn't.
It's frustrating. It can be very frustrating.
And so, you know, we've figured out, you know, okay, they can get on camera, but they can't get audio. So we can get on the phone and do like a 4-way call with the patient and the doctor and social worker and the nurse, and be able to talk that way while we're doing the video visit. You know, it just kind of depends.
Kate, palliative care, not just about the medical treatment and that side of it, it's also about emotional and logistical support. How does telehealth help you connect with families in need?
Yeah, I think the wonders of telehealth is I can see the patient and family. When we're talking, I mean, I can talk to someone on the phone, but there's nothing like seeing someone's face, emotions. I do a lot of my job by reading nonverbal cues. And so being able to see that and helps me understand where I can help support patients and families. And then also we have hard conversations sometimes in palliative care clinic, and being able to just eye to eye say, gosh, this is really hard, and we're here to support you and talk about these tough issues and hopefully make them a little bit easier. There's still hard things to talk about, but just being able to see somebody, even through a video screen, I think opens up our ability to really help them as a whole person. And then logistically for telehealth, especially with Eugene and Sharon, every time we would meet, then I would communicate with their local home health and hospice agency to make sure that they knew that we had met with them, that here's what our plan, so that if Eugene and Sharon ever needed emergency assistance, their community already knew how to best care for Eugene. And so some of it is just logistics behind the scenes, connecting patients and families with those local resources, if we have them, to make sure that if there is a crisis, it's as calm as it possibly can be. So a lot of the telehealth then continued on afterwards by connecting patients and families with those resources.
That makes sense.
Yeah.
Dr. Porter-Williamson, telehealth, of course, expanded during the pandemic, but what did you do before that? Do you think that meant that fewer patients were getting care?
I think we're realizing that, you know, there were patients who just didn't have access to us. I would have never met Eugene and Sharon if we didn't have telemedicine access. It was so hard for them to get up to Kansas City. And so, yeah, I mean, I think we did all of our clinics in person. One thing that stands out to me is that with telemedicine in place, our likelihood of a no-show, so somebody who has an appointment scheduled, them not being able to keep it, not showing up, the likelihood of a no-show goes way down. And even when we have someone who's scheduled to be seen in person, if they're really not feeling well, and where they're like, I'm too sick to come in there today, we can hook up on telemedicine and see them on telemedicine. We can convert an in-person visit to a telemedicine visit and then still see them and assess, like, oh, do you need to get to the emergency department? You know, what's going on? What do things look like there? And so I really feel like telehealth is such an important complement to our in-person care. It's an additional tool that allows us to provide access even when they need to be seen. The telemedicine is still an adjuvant that we can use to improve their care.
The waivers that expand telehealth access during the pandemic might be going away. They were set to expire on April 1st, but then they were extended up until October for now. So what's being done to protect telehealth?
Yeah. I get a little bit out of my lane here because I'm not a policy person, but you know, there is legislation at the state and national levels. The national legislation is bipartisan. That is how the telemedicine things were extended into the current funding bill. But so that ongoing advocacy for legislation to make the telehealth changes permanent and to continue to optimize how we can deliver telemedicine, those are very important. Advocacy is happening all across, you know, the hospital organizations, physicians organizations, certainly the American Academy of Hospice and Palliative Medicine, other specialty groups. I know the American Academy of Neurology really advocating strongly that this is not, this isn't extra. This is basic access to medical care for folks who have a difficult time getting in to see their doctors in person. And you know, it may be that they're going to be seen once a year in person, you know, and then, or if there's an acute change in condition, but then the in-between times using telemedicine to make sure they're having regular access.
Lauren, how does telehealth help with urgent symptoms, especially in palliative care where comfort obviously is a priority?
Yeah, we're definitely, you know, even though palliative care can come along patients from the time of diagnosis with a serious illness, we're often seeing folks who really have some complex things going on, and sometimes the sickest of the sick. And if we're talking to a new referral or even a longstanding patient and we're hearing things are, you know, more urgent. We're lucky to work with, you know, these wonderful providers who trust us nurses if we say, like, hey, we need to see this patient and it can't wait until the next clinic. It's a lot easier to add on like a lunchtime telehealth visit than to try and find clinic space. And especially if they're not feeling well, it's a lot easier for a patient to say, like, yeah, I'll jump on my video than jump in my car, because that may not even be possible. And also in those times, you know, like what Kate said, if we're having to have like these conversations that we're getting to a different place now, and you know, we need to talk about some things. They're in their place of comfort. They're not in a sterile exam room. You know, it's a lot easier, and we have the ability to bring in family for those visits. Even if they're not with the patient, we can shoot them a link, and someone in New York or California can be on this video and talking about hard things in real time.
That makes sense. Yeah. Kate, what challenges do caregivers face, and how has virtual access to a social worker improved their ability, you know, to cope and communicate?
Yeah, I think being a caregiver for a loved one who has a chronic or critical illness is, I mean, Sharon can tell you, it's hard. This is not an easy job to tackle, and a lot of our caregivers are still working. They've got families. There's just a lot going on. So being able to touch base with the caregiver, assess how they're doing, provide them support, and also start to think about outside the box about how do we get other resources into the home to help support the patient and the caregiver. You know, as Sharon mentioned, there's not a lot of access to healthcare and resources where she is living, and so there's also not a lot of social work access either. You know, we're very lucky here in Kansas City that we've got lots of social workers that are aligned with lots of different clinics and in the hospitals, but I know that in more rural communities, they don't have that luxury. So being able to touch base with patients and caregivers, talk about what are our areas where we could add some more resources, and then us as social workers take it a step further and try to find those resources, connect with those resources in the community. Think about, you know, getting extra support creatively. You know, we talk a lot about insurance and planning, and you know, what do we do when care changes too? How do we get those resources in place? So really, that's been a huge, I hope, help for our patients and families to add some resources, and then also just providing an extra layer of support to these patients and families who are going through some really, really hard stuff, and allowing them the time to talk. I agree with Lauren, in the comfort of their own home, say this is really hard, and allowing them the time to bring that out into the open and discuss, you know, what's going on, and then provide them support and acknowledgement and validation that what they're going through is tough, and they're not alone. They have us, and we try to help as much as we possibly can to get those access to resources as well.
Well, be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Sharon, how much of a learning curve did you have with telehealth?
Well, before COVID, I had only used Zoom like once or twice, and I wasn't having very much luck in joining a group. So Lauren was really excellent at helping me to figure out where to turn on the sound, how to get the camera in the right place. She made it very easy. And to be honest, that the KU portal, where we can go in and send a question to the doctor or the nurse directly. That's amazing too, because then I know that they receive the communication for one thing, and they're very good about getting back to us with it. And as Lauren mentioned, scheduling another clinic if we need it.
Yeah, she's like a pro now, right? So yeah, she's like a techie. She turned into a techie, just like that. So I'm just playing devil's advocate. Is there anything that could be missed in telehealth? Just maybe somebody walking differently, or a tremor that you might not see, or maybe somebody's trying to keep something that they don't, or maybe something they don't think is a big deal that you might notice as a doctor if somebody was in your clinic.
Yeah. So, you know, I think we always are taught in our training that 75% of a diagnosis is in the history. And when we are learning our patient, you know, when we're talking with our patients and families, that communication of a solid, like really thorough symptom assessment, where we're asking them all of the possible different things that are going on, we're engaging their family members, you know, to say, what are you noticing? You know, how are things going? And so we spend a lot of time in assessment and history taking. That being said, yes, there's absolutely a need for in-person visits when those are possible, you know, and the combination of in-person and telemedicine visits, really thinking about what's the best way to provide care to that person. You know, when I think about palliative medicine, we're dealing with symptoms and progression and communicating about all of those things, and communicating a lot with them about what they're experiencing and with their caregivers. I always loved, so when we would see Jean, Sharon would always be off camera, but I would hear her. And so then we'd be like, Sharon, you get on the camera. And so she would like stick her head in the camera and be like, okay, Sharon, what's your perspective? And when teams take the time to ask patients, to ask their loved ones, what are you experiencing? what are you seeing? A lot of those things come out.
I think you're right. There's a clinical, sterile environment sometimes when you get your car, go see your doctor, and then there's this different at-home, very relaxed environment. I think you had mentioned that, Kate, that you see people a lot more relaxed, letting their hair down, saying things maybe that they wouldn't say. So maybe there is something to be said for that. So the outpatient palliative care program here at the health system was part of a large study comparing in-person visits to telehealth visits for people with advanced lung cancer. The clinical trial results published in JAMA showed that quality of life was the same, regardless of whether patients came in person or did a video visit. So Dr. Porter-Williamson, what do you make of those findings?
Well, what I take away, that was a really well done study. And what I take away from it is that telemedicine is a valid and useful tool for us to use as we take care of our patients and families. I think there's the idea of, is telemedicine better? Do we get rid of in-person? No, it's a balance, and to know that in studies we now see that telemedicine, that outcomes that we're looking for, especially when it comes to symptom management, quality of life support, communication with patients and families about what's going on, that those services are effectively delivered via telemedicine.
When we met Sharon, we heard a little bit about Jean off the top of the program, but throughout all of this, Jean became a big advocate for telehealth. Who knew, right? And so tell us about his legacy as we continue to keep telehealth a big part, being front and center.
Yeah, as we took care of Jean and Sharon, we would just talk about how blessed we felt, to be able to see him via telemedicine, because in person wasn't possible for him, and he certainly recognized how important that access was. And Sharon said at the beginning about how, Jean was a go-getter. He was involved, he was smart, he was an advocate. And so he would say to us, we want to make sure that this doesn't go away, and I want to help you, because our story is an important example of how critical this access is. And so we had some opportunities. We did another video that you're seeing the B-roll every now and then of that video. We were able to present that video to the Kansas legislature at the Bob Bethel Committee. That was a bit of a year ago or so, and to really raise the level of awareness about how important this is for telemedicine, but also for high-speed internet access. We know that broadband is so critically important. It's like paved roads now. This is where we're at, and our society is connected via telecommunications in this way. And so his legacy to help us get the message out, even in this forum here where Sharon's able to come back and talk with us, this brings Eugene right back here with us.
Sharon, I'm sure that Eugene's legacy entails a lot of amazing, wonderful things, but how important in regards to telemedicine is his legacy?
Very important. It was something that he felt about very strongly, and as do I, because he would not have gotten the care that he got, and he would not, I believe, lived as long as he did without the virtual visits. I know that the other thing would be that it did allow him to stay at home when he passed and to live with dignity. I just want to thank Dr. Porter-Williamson and Lauren and Kate for what they did, and I pray that this continues for everyone.
Well, we do want to get to some questions from our viewers, and Jeremy has one. Being able to switch to telehealth when you feel too sick to come in physically makes a lot of sense. He says, I imagine that's similar to when you're trying to avoid things like measles or flu, whenever the current bug is everywhere, it seems like at the time. Do you see more appointments happening and better outcomes when telehealth is an option?
I really feel like it's clear our no-show rate is less when we're able to have telemedicine as an option, and when people need to see their doctor and they're not feeling good, using that is really an important tool. What would you guys have to say?
I think also from a resource standpoint, transportation, getting to appointments. I know Sharon kind of talked about how complicated it was to, pack Eugene up and bring him in. But also, when our patients are going through these chronic and critical illnesses and they're not able to work and finances are a hardship, gas is expensive. Someone taking time off to drive someone here too. So I think it also, yes, it helps with exposures and those things, but I think it also helps with anxiety and stress of coming to the doctor that could cause with, the money it costs to get here, your equipment. I think there's a lot of things that it does help improve patients' quality of life all over, across the board.
Yeah, I agree.
I want to get our takeaways today. And Sharon, we'll start with you. Again, just thank you so much for sharing your story, talking a little bit about Eugene today. It's been great learning more about him. And what do you want people to take away from your story?
Just how important telehealth is. It just is life-changing for not only the patient, but for the caregiver. As we have talked, if I tried to take Gene to Kansas City, it would have been impossible. He just would have not made the trip. And he was very much homebound in the end. And without telehealth, I don't think he would have had the quality of care that he received. And that's how important it is.
Kate, what's the big takeaway today?
I think the big takeaway is telehealth is critical for patients all over our state of Kansas. I mean, Sharon and Eugene are out in Liberal. We have patients here locally that can't get to us. It's too difficult. And I think the impact and the effect of telehealth is far-reaching, and it's a great service, and it's just as wonderful as coming in to see us. We'd love to see you too, but we know that always can't happen. And I think the way that it connects patients and families to their medical team is phenomenal. And I am honored to be able to be a part of a telehealth experience and meet patients and families who can't get into our clinics.
Lauren?
I would just say, telehealth is something that most everyone can do. There are plenty of resources for folks who may be a little leery of the technology. We are always happy to help. We have MAs who are wonderful with getting patients on telehealth. And it is possible to provide quality care via telehealth that might not otherwise get to happen, and to be able to have those relationships and to be able to help people in their place of need is invaluable.
Dr. Porter Williamson.
Thank you. As I've been sitting here thinking about this, we always want to do our best to improve the value of the care that we are providing for our patients and families. And that's folks who are needing palliative care, dealing with serious illness. There's lots of folks who are living with chronic conditions that decrease their mobility and their inability to get back and forth. And so really, beyond palliative medicine, for all the folks who need this kind of access, being able to improve the quality of their care. And I would say, I wish I could see a study of the global impact on cost. So for the families, for their kids who have to drive them, for all of the expenses of cross-state cost to do in-person care, if they don't have that access to telemedicine, the value is higher when we're able to provide those things together.
Great conversation. Thank you so much. Thanks to all of our guests. Thanks to our viewers for being with us today. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update, a new organ brings new life from barely leaving the recliner to dancing on New Year's Eve. I'm Jessica Lovell on the next Morning Medical Update, the complete turnaround after a painful wait on the transplant list, how one man survived severe liver disease, Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.